It's still too early to tell how the fallout of COVID-19 will impact us in the coming years. We've explored various facets, including fertility among women, but not among men until now. Joining us with some perspective on today's research into the subject is Dr. Heather Cook, fertility specialist at Coastal Fertility Specialists. It's good to see you again.
You also. Thank you for having me.
So we want to talk about male fertility, but while we're here,
Right.
I realize we're still in the nascence of learning more about COVID-19 and just the health impacts in general that we could be experiencing if we've been exposed down the line. What research is being conducted now that would have an effect on male fertility?
So it's interesting, like most things with COVID, there is very little data, but there is emerging data coming out. Male fertility is one of the things that has come into interest really because a lot of the parts of the cells that are in the respiratory tract these viruses are thought to bind to are also found in the male reproductive system. So that's why it's been looked at a little bit more extensively. So the studies that have come out so far do show us that there can be effects of men's sperm as far as the number of sperm and the quality of sperm, really kind of in that active infection and potentially for that early recovery, maybe about a month afterwards. And that is really about as much as we know. We don't know how long that effect lasts and if that's an effect that is seen in everybody, but there is thought to be some potential aspect of male infertility from COVID-19.
That's interesting. So further studies need to be done, but we don't want to scare anybody either to say that if you've been exposed to COVID-19, if you've actually fallen ill with it and you're young and you're hoping to have a family in the future, that necessarily makes you sterile down the line, but it is something that could potentially have some sort of an effect. We also spoke with a doctor, urologist, to talk about Prostate Cancer Awareness Month. September is Prostate Cancer Awareness Month. And when you're talking about suffering from any types of cancers, how does that affect a man's fertility?
So we know that any form of chronic illness, cancer included, where the body is kind of at a chronic stress and ill state, can definitely impact sperm counts. When men are having to go through treatment for their cancers, that's another big thing we consider, because if they're undergoing chemotherapy or radiation, those can all have major impacts on male fertility and can actually cause men to be sterile after treatment. So we see a lot of men at their initial cancer diagnosis that come in to actually preserve and freeze sperm prior to undergoing those toxic therapies.
That is something I was just going to ask you. So they do take some set of precautions or insurance that they can still have children in the future if they do need to undergo some of these more serious treatments?
Correct, that's correct. We can freeze sperm, we can freeze one vial, multiple vials that will give them some protection for fertility later on.
I see. And anything else in the arena of male fertility? Any other new findings or research that's being conducted?
You know, it's interesting, not a lot of new findings, but we do see that there is a misconception in the population and also with some physicians that men who are on testosterone supplementation are actually going to be found to have usually very low sperm counts or no sperm counts. And so usually when men are having infertility issues, that is associated with having low testosterone. And so it would make sense that they would go on testosterone to fix that problem. But that actually is not what you want to do. When men go on testosterone, that actually will shut off almost completely sometimes the sperm production. So the bottom line is, if you are trying to get pregnant, make sure you are not on any sort of testosterone supplementation.
And just real quick, why would someone be taking testosterone?
For men who are having low testosterone issues, which sometimes are associated with fatigue, low sex drive, low libido, they will get put on testosterone or start testosterone to help those symptoms.
I see. Well, we've got so much more to talk about on the subject, but unfortunately we've run out of time. So we hope to have you back, Dr. Heather.
Thank you so much.
Thank you so much. We're back in 2 minutes.